as we have completed our chapter anatomy from revision notes, Oxford revision notes, and now let us practice some anatomy MCQs from the book Pass MRCUG. Okay, now let's start with the question number one. Question number one is, which laser they can be used in a gynecological surgery is invisible without an aim beam and cannot be transmitted down a fiber optic cable? So the answer is the carbon dioxide. Now let's see the explanation. The carbon dioxide laser, it generates an invisible light and requires an aiming beam and usually helium and neon. It cannot be transmitted down a fiber optic cable and is absorbed by the water. It is used in cervical treatment but is limited by the fact that it does not work in the presence of the blood. So here we have noticed that the carbon dioxide, it is an invisible light, but it needs a medium like helium or neon for its aiming, and it is not able to be transmitted down a fiber optic cable as it is absorbed in the water. So as this is absorbed in the water, it will not work in the presence of blood, as blood is a water medium. Now let's move towards the question number two. Which laser can be used in, I think the question is repeated, and again the invisible laser is carbon dioxide, and it does need the aim beam, which is a helium or neon, and as it is not able to be transmitted with the fiber optic cable, and as this is absorbed in the water, and hence as it does absorb in the water, it will not work in the presence of blood. So now moving towards question number three. What is the anterior boundary of the pelvic outlet? Anterior boundary, we have to choose from here the pubic arch, ischial tuberosity, the pubic crest, the pubic tubercle, and the sacrotuberous ligament. The correct answer is the pubic arch. Anteriorly, if we make a rough diagram, anteriorly there is pubic arch, then laterally there are the ischial tuberosities, and then posterolaterally they are the inferior margins of the sacrotuberous ligament, and posteriorly there is a tip of coccus bone. Okay, the pelvic outlet, it is also called the inferior aperture, and the pelvic brim is the superior aperture. Okay, this is the pubic arch. This is a rough diagram, sorry for the bad diagrams, but we have imagined that this is the pubic arch, this is the pelvis outlet. The anterior is formed by the pubic arch, the laterally there are the ischial tuberosities, and posterior laterally there are the inferior margins of sacrotuberous ligament, and posteriorly there is the tip of the coccus bone. Now let's move towards the next question. What is the appropriate length of the male urethra in centimeters? It is 22.5 centimeter. Male has the longer urethra than females, and in the males there is the 15 to 29 centimeter long, and they are often quoted as an average is 20 to 22 centimeter, and they are divided into 3 or 4 parts, as some they consider the prostatic and the pre-prostatic as the separate parts. The females, they have the shorter urethra and it is approximately 4 centimeter long. Now let's move towards the next question, the question number 5. And a patient attends a clinic with a vaginal prolapse. On examination, the vaginal prolapse is a visible 1.5 centimeter above the plane of hymen. According to POP-Q classification, what grade is this prolapse? For this we have, let's discuss the grades of the POP POP-Q classification, and the POP-Q classification is basically the pelvic organ prolapse quantification, and it is a system which is based on the position of most distal portion of the prolapse during the straining, and it is graded uh, as the zero grade is means that there is no prolapse. The grade 1 is when there is more than 1 centimeter above the hymen. The grade 2 is within 1 centimeter of the proximal or distal, either proximal or either distal. If this is the hymen, either proximal or the distal plane of the hymen, that will be grade 2 prolapse. Then the grade 3, when it is more than 1 centimeter of the plane of the hymen, but it is less than 2 centimeter in the total length of the vagina. And then grade 4, it is the complete eversion of the vagina. The degree of the now let us see the degree of the uterine descent. It can be graded according to the Baden Walker or the Beecham classification system. If you see the Beecham classification system, the first degree is the cervix. It is visible when the perineum is depressed. Prolapse is contained within the vagina. The second degree is the cervix prolapse through the introitus with the fundus remaining in the pelvis. And the grade 3, oh sorry, it is the third degree, that is a complete prolapse. Entire uterus is outside the introitus. The Beecham and the POP-Q classification, but here the question was according to our POP-Q classification. So let's see what they have asked. Number one, that there is a vaginal prolapse. When a doctor examined the prolapse, it is a visible 1.5 centimeter above. If this is a hymen, it is 1.5 centimeter above the plane of the hymen. And as we have discussed that in the it is the grade 1 where the prolapse is more than 1 centimeter above the hymen, then it will be classified as the grade 1. So our answer is grade 1. Now move towards the next question. Which cell type of the testes they secrete the inhibin? It is the hormone which is secreted by the testes, and we have discussed, we know that the testes has different types of the cells, and it is the Sertoli cells which secretes the inhibin. Basically, the Sertoli cells, they secrete inhibin, which forms the blood testis barrier, and they have FSH receptors. The other cells are the Leydig cells. They secrete the testosterone, and they have LH receptors. Now let's move to our next question, and here again the question is the same, but they have asked regarding the pelvis outlet boundaries, and we previously know that they have asked the boundaries, and that was the answer was the pubic arch, and here the answer is the tip of the coccyx. It also makes the boundary of the pelvic outlet. We have discussed as anteriorly there is the pubic arch, then laterally there are the ischial tuberosities, and then posterolaterally there are the sacrotuberous ligament, and posteriorly there is the tip of the coccyx. So according to the options given here, the answer will be the tip of the coccyx bone. Now move towards the next question, that the medial umbilical ligament is a remnant. This is a medial umbilical ligament. It is a remnant of what structure? The medial umbilical ligament, they are the remnants of the fetal umbilical arteries. The question is basically your recall based, and you have to actually memorize the remnants, and also the remnants which are converted to the adult structures, and the adult structures which used to be in the fetus, the both. Otherwise they can ask you the both ways. And the medial umbilical ligaments, they are the remnants of the fetal umbilical arteries, and the median umbilical ligaments, they are the remnants of the urachus. You have to you have to be very careful while when you are reading your questions, because many questions they sounds the same, and you have to read thrice before you answer the question. So the medial umbilical ligaments and the median umbilical ligaments. The medial umbilical ligaments, they are the remnants of the fetal umbilical arteries, and the median umbilicus ligaments, they are the remnants of the urachus. Now let's move to the next question. Which part of the nephron is responsible for 100% of the glucose reabsorption in a healthy adult kidney? If you see the questions, they have asked that which part of the kidney or the nephron which absorbs the 100% of the glucose. It is the proximal convoluted tubules. The majority of the reabsorption of almost all solutes occurs in the proximal convoluted tubules. Now the next question, which artery is associated with the midgut? It is the internal iliac artery which is associated with the midgut. The foregut, it has got the celiac trunk. The midgut, it is superior mesenteric, and the hindgut, it is the inferior mesenteric artery. So they have asked the midgut. It is a superior, it is internal iliac. Here we have seen that the celiac trunk uh, uh, as the blood supply to the foregut. The midgut is by the abdominal aorta. Then there is artery arises which is the inferior mesenteric artery, and the superior mesenteric artery. The superior mesenteric artery is going to supply the blood to the midgut, and the inferior mesenteric artery it is going to supply the hindgut. Okay, I think the question is clear, but one thing I have issue here, that there is the option of the superior mesenteric also, and we have to choose the superior mesenteric rather than the internal iliacus. Sorry, this is the answer is wrong. We have the option of the superior mesenteric artery here. One thing you must remember here, again you have to read the question very carefully, and again you have to read all the options given. Okay, and after then you will mark your answer. Now let's move towards the question number 11. Regarding the female breast, how many lobes does the typical breast contains? This is a very simple answer. It is a 15 to 20 lobes. The basic components of the mammary glands, they are the alveoli, and they are linked with the milk secretory cuboidal cell supplied by the myoepithelial cells, and the alveoli they joins to form the group of as the lobules. These lobules they form the lobes, and each lobe they has a lactiferous tract that drains into the opening into the nipple, and each breast typically contains a 15 to 20 lobes. Now let us move towards the next question. Uh, the question is, you are called to see a woman after a prolonged labor with failed instrumental delivery, converted to C-section. She complains of pins and needles to the left thigh. On examination, the anterior left thigh, including the anterior knee, the anterior, if it, this is left thigh. If this is a diagram of the left thigh, then the patient is complaining of the pain in the anterior left thigh, including the anterior knee, and has reduced the sensations, and there is a reduced power on testing the extensions. And what is the likely diagnosis? The quadricep weakness, the quadricep muscles, anterior thigh has contains quadriceps muscles and anterior thigh sensory disturbance. It fits with the femoral nerve palsy, and also as there is a difficult prolonged labor which has converted later to the cesarean section, then the femoral nerve is involved. Then it Also, the dermatomes which covering the knee, they are typically L3 medial, L4 anterior, and L5 lateral. These are supplied by the femoral nerve, and this is the femoral nerve palsy. Now, the sacroiliac joint is what type of the joint? It is the synovial joint. The sacroiliac joint, it is a synovial joint, and the pubic symphysis, it is the secondary cartilaginous joint. Which of the following nerves they passes through the inguinal canal? These are the ilioinguinal nerves which passes through the inguinal canal. The other contents of the inguinal canals in the female, there is the round ligament of the uterus and the ilioinguinal nerve. In the males, it is the spermatic cord and the ilioinguinal nerve. So this is the inguinal canal, and it has got the two rings. This is the superficial inguinal ring, and this is the deep inguinal ring. And this canal in the females, it contains the round ligament and ilioinguinal nerve. In the males, it contains the spermatic cord and the ilioinguinal nerves. And ADH, next question. The ADH increases the permeability of which part of the nephron? ADH, it acts on the collecting duct, and it increases the permeability of the collecting ducts, and which lead to the increased water reabsorption and reduce the water content lost in the urine. The next question, and which of the following arteries they branches directly from the aorta? These are the ovarian arteries in the females, and they are the direct, they arises from the aorta. The uterine and the vaginal arteries, they are the branch of the internal iliac arteries. The ovarian arteries, they branch directly from the aorta. These are the ovarian arteries. And the uterine and vaginal arteries, they comes through the internal iliac arteries. The next question, the sensory supply of the clitoris is by the branch of the pudendal nerve. It is the branch of the pudendal nerve which supplies the clitoris, and the pudendal nerve, it divides into the inferior rectal, the perineal, and the dorsal nerve of the clitoris. This is the pudendal nerve. It is divided into the dorsal nerve of the clitoris, and it also divide into the perineal, and also the inferior rectal nerves. And uh, and uh, uh, and this, the dorsal nerve of the clitoris supplies the sensory innervation to the clitoris, as the name indicates, and the perineal branches, they supply the sensory innervation to the skin of the labia majora and the minora and the vestibule. Now the next question, the sensory supply of the clitoris is what? This is again the repeated question. It is, the answer is again the pudendal nerve, and we have studied at the pudendal nerve. It is divided into the inferior rectal, the perineal, and the dorsal nerve of the clitoris. The dorsal nerves of the clitoris is going to supply the clitoris. The perineal, the branch is going to supply the skin of the labia majora and the minora and vestibule, and the inferior rectal artery is going to supply it is the nerve which is going to supply the rectal area. Now the uterine vein, it drains. Where the uterine veins, we have studied that the uterine arteries, they are going to arise from the internal iliac arteries. The veins are, they travels with them, hence the uterine vein is going to drain into the internal iliac vein. The answer is A. Let's see the explanation. The basic knowledge of the venous drainage, it should be known, yes, but this is very important because many questions they have been asked from the vascular system of the body, especially the abdomen and the pelvis. And uh, let's move to the next question. The internal anal sphincter, it is innervated by which nerve? It is innervated by the pelvic splanchnic nerves, and the internal anal sphincter, it is involuntary, and it is the sympathetic contractions and parasympathetic relaxations, and innervated by the pelvic splanchnic nerve, which is the S4. and external inner sphincter, it is voluntary. the the difference between that internal inner sphincter, it is involuntary, but the external inner sphincter, it is voluntary, and it is innervated by the inferior rectal branch of the pudendal nerve and the perineal branch of the S4. This is the anus, and this is the internal anal sphincter, and this is the external anal sphincter. This is internal anal sphincter, and this is external anal sphincter. Now the next question, you are asked to assess a patient's perineal tear, which is following the labor by the vaginal delivery. You note a laceration that extends through the vaginal mucosa into the perineal muscles and fascia. The external anal sphincter appears to be intact. How would you are going to classify this tear? So before answering the question, let us see the explanation that the external inner sphincter, this is very important, the external inner sphincter, if it is intact, then it is the first degree or the second degree tear. So the most important thing in the question is that either the external anal sphincter is intact or not. So here the external anal sphincter, it is intact, then it will be either the first or the second degree. Okay, as the perineal muscles, they are involved, then it is the second degree. When the muscles are involved, we say that the episiotomy, it is the second degree tear. In the episiotomy, when we cut the mucosa of the vagina, we also cut the muscles of the muscles. Hence, when the muscles are involved, then it is the second degree tear. Now the next question, the testicular arteries are the branches of what? The testicular arteries are the branches of what? We see that the ovarian arteries, they arises from the aorta in the females. Similarly, the testicular arteries in the males, they are going to arise from the aorta. So these are the branches of the aorta. Anatomy of the male genitalia is very important, and they ask questions from the male as well as female anatomy. So you have to be very clear regarding these two anatomies. And then we have also noticed that the testes, they have the different blood supply from the scrotum or the external genitalia. The scrotum is supplied by the anterior and posterior scrotal arteries, which are the branch of the external and internal pudendal artery. But the testes, they have the separate supply. The testes is supplied by the three arteries. Number one is the testicular artery, which arises directly from the aorta. Then the second is the cremasteric artery. This is a branch of the inferior hypogastric. And then the artery to the vas deferens. It is a branch of the internal iliac artery. Internal iliac artery. Okay, very important question. That the testicular arteries, they are the branch of the aorta. The cremasteric arteries, they are the branch of the inferior hypogastric, and the arteries to the vas deferens, they are the branches of the internal iliac. Now the next question, how many seminiferous tubules they would you typically expect to find in a testicular lobule? They are the 20. Okay, question number before answer, let's again see the explanation that there are between the 250 to 400 lobules in each testes. So we have the question is it is about the seminiferous tubules. Would you typically expect to find in the testicular lobule? Let's proceed the explanation. The lobule is the structure unit of the testes, and with each lobule it contain in one of the interval between the fibrous septa, which extends between the mediastinal testes and the tunica albuginea. Each lobule contains 1 to 3 seminiferous tubules. 1 to 3 seminiferous tubules. Okay. Let me explain this for you. There are the two testes, and this says that each testes has 250 to 500 lobules. Like there are the 250 to 500 lobules in each testes. Okay, 250 to 400 lobules. Okay, then the lobules, it is a basic unit, or you can say it is a structural unit of the each testis. This is the lobule. Okay, we have made a big lobule here. Okay, and this lobule, it has the interval between the, like there is a fibrous septa, and which extends from the mediastinum of the, this is the mediastinum of the testis, and it comes down towards the tunica albuginea, which covers the whole testes. Okay, and then each lobule, it has 1 to 3 seminiferous tubules. So the question is we have the in the options it is 2, then we can say that it is the 2, and as there are the 1 to 3 seminiferous tubules in it. Now let's move to the next question. Regarding the pubic symphysis, which type of the joint is it? We have also discussed this previously, that it is the fibrous joint. The pubic symphysis, it is a midline cartilaginous joint, and it may further classified as a secondary cartilaginous joints, and primary cartilaginous joints. They are also called the synchondrosis and are only seen in the children. In the adults, it is the secondary cartilaginous joint. And the ends of the two pubic bones, they are covered by a thin layer of the hyaline cartilage. This cartilage is attached to the fibrocartilage, which forms a disc. The disc reinforced by the ligament. Now let's move to the next question. The femoral triangle, it is bounded medially by which of the following structures? It is bounded medially by which of the following structures? It is the adductor longus. It is adductor longus, and the femoral. Let's see the femoral triangle branches. Superiorly, there is the inguinal ligament. Superiorly, there is the inguinal ligament. Medially, it has the, if this is the middle, and we are on the discussing the right side of the human body, then on the medial side there is the adductor longus. On the lateral side, there is sartorius. The floor is formed by the pectineus, adductor longus, and iliopsoas muscles, and the roof is formed by the fascia lata. Okay, if we just imagine that there is a triangle, then superiorly there is the inguinal ligament. Superiorly, the inguinal ligament is passed, but the roof is formed by the fascia lata, and on the medial side there is adductor longus, and on the lateral side there is the middle part of the sartorius muscles, and on the floor there is the pectineus, adductor longus, and iliopsoas, or you can say PIA, if you want to remember this. Okay, and this is a triangle. And now let's move towards the next question. Regarding the pituitary gland, which of the following statement is true? Regarding the pituitary gland, which of the following statement is true? It rests. Okay, before discussing towards the options, let's see the explanation. The pituitary gland, it is an endocrine gland. We all know that it is a pea-sized and protrudes from the end of the hypothalamus, and it sits in the bony cavity which is known as thala turcica, and it is a part of the sphenoid bone in the middle cranial fossa. So let's move towards the options. It rests on the ethmoid bone in the skull. No, we have discussed that it rests in the sella turcica, which is a part of the sphenoid bone, and passes through the foramen rotundum. No, the pituitary gland, it is a pea-sized gland which is protrudes from the end of the hypothalamus, and then it is surrounded by the sella turcica. Yes, this option is true, and it's primarily an exocrine gland. No, it is an endocrine gland, and is a part of the posterior cranial fossa. No, it is a part of the middle cranial fossa, which is the sphenoid bone, and which is the sella turcica. Now let's move to the question number 27. And a patient, it undergoes the oophorectomy, and the ovarian veins are ligated. Which vein does the right ovarian drains into? We all know that the right ovarian vein, it drains directly into the inferior vena cava. And when it comes to the questions on the venous drainage, the ovarian vein is likely to be a common question. It is given its varied drainage depending on the laterality. The right ovarian vein, it travels through the suspensory ligament of the ovary and generally joins the inferior vena cava, where the left vein, it drains into the left renal vein. The question number 28, a patient who is 36 weeks pregnant, they comes to see you as she has developed the tingling to the right lateral thigh. Lateral thigh over the past 3 weeks. On examination, there is no skin changes and no muscle weakness. What is the likely diagnosis? The raised pressure with the pelvis, they can cause a number of the nerve entrapment syndromes. This is entrapment of the lateral cutaneous nerve of the thigh or the lateral femoral cutaneous nerve, also known as the myalgia paraesthetica. This is the myalgia paraesthetica. The pregnancy, it is a risk factor, and the shingles, it can affect this nerve, but the rash, they would usually present itself within the 14 days. So the patient is having the tingling to the right lateral thigh over the past 3 weeks. On examination, there is no skin changes and no muscle weakness. If there would be the shingles, then the rash would have appeared in the 14 days of the onset of the symptoms. But in our case, the past 3 weeks have passed, but there is no changes. But we know that in the pregnancy, there is a raised general pressure, and this pressure can cause the nerve entrapment syndrome. And here it is the myalgia paraesthetica, which is the involvement of the lateral cutaneous nerve of the thigh or the lateral femoral cutaneous nerve. Now let's move to the question number 29. Looking at the diagram of the fetal skull below, the sagittal suture is represented by which label? Here we see that this is the sagittal suture, and the correct answer is H. Okay. We'll further discuss all the sutures in our coming questions, so I'm not discussing it here. Let's move to the next question. The pudendal nerve, that travels through the greater sciatic foramen. The pudendal nerve, it travels through the greater sciatic foramen. What are its nerve roots origins? The greater sciatic foramen. You see, they like they ask the questions in a different way, so you have to read the question as before thinking of the sciatic nerve. You should see that they have asked the pudendal nerves. The pudendal nerve and the nerve roots of the pudendal nerves, they are S2 to S4. The pudendal nerve, it is formed by the sacral nerve root, which is S2, S3, and S4, almost intermediately as they exit from the spinal foramen. Here you see that this is the pudendal nerve, and no, sorry, this is the pudendal nerve. This one. Let me mark it for you. This is the pudendal nerve. Okay, this, and the pudendal nerve, they exist the pelvis by the great sciatic foramen, and it travels behind the sacrospinous ligament, and before entering the pelvis by the lesser sciatic foramen, it is important enough to be aware of it, as it supplies the sensations to the genitalia and can also be damaged or compressed at the number of the places along its course. Okay. I think yes, they have asked a different question here now. Looking at the diagram of the fetal skull below, the lamboid now previously they have asked the sagittal suture, which was this is the sagittal suture. Now they have asked regarding the lamboid suture, and here the lamboid suture is this is the lamboid suture, the sagittal suture and the lamboid suture, the sagittal suture and the lamboid suture. Okay. Now moving towards the next question. Which of the following muscle is contained within the superficial perineal pouch? Apart from the ischiocavernous, all the muscles are the muscles of the deep perineal pouch. So the ischiocavernous muscle, it is present in the superficial perineal pouch. The external sphincter muscles of the urethra, the deep transverse perineal muscles, the compressor urethral muscles, and the urethrovaginal sphincter. They are the part of the deep perineal pouch. The ischiocoroneus muscles, these are the part of the superficial perineal pouch. Which of the following it leaves the pelvis by the greater sciatic foramen? We have discussed that it is the pudendal nerve which passes by the uh, mm, greater sciatic foramen, and it is formed by the root of the S2, S3, and S4, and it immediately exists. And it is formed as soon as they exist from this spinal foramen. They are going to form the pudendal nerve. And the pelvis, it leaves the pelvis by the greater sciatic foramen, we have discussed it previously as well, and then it travels behind the sacrospinous ligament, and it enters into the pelvis again by the lesser sciatic foramen. And now let's move to the next question. The arterial blood supply to the bladder is by the branches of the internal iliac artery. The internal iliac artery, it supplies the bladder. The femoral triangle, it is bounded superiorly by which of the following? We have discussed it above, that it is the if we consider this as a femoral triangle, somehow it look like this, and superiorly there is the inguinal ligament. Sorry, this is not the canal. Here I'm marked on the canal. It is not canal, it is inguinal ligament. And then medially there are the middle border of the adductus longus, and laterally there are the middle borders of the sartorius, and the floor, it is formed by the pectineus, adductor longus, and iliopsoas muscles, and the roof is by the fascia lata. Now, regarding the ovarian artery, which of the following statement is true? Regarding the ovarian artery, number one, that it arises from the external internal iliac artery. No. It arises from the external iliac artery. No. It arises from the uterine artery. No. It is arises from the abdominal aorta. Yes, we have discussed it previously. And then it arises from the renal artery. No, they have asked the ovarian arteries, they arises directly from the abdominal or aorta. And in the course they might anastomose with the uterine artery, but it directly arises from the aorta. Now you see a patient who is 32 weeks pregnant, and she complains of the tingling of the right buttocks and the shooting pain down the leg. You suspect the piriformis syndrome. Regarding the piriformis, which of the following statements they are the true? Now let's see the nerve supply um, to the piriformis is the L2 to S5, and origin is by the sacrum, and insertion is on the greater trochanter. The piriformis muscles, it originate from the sacrum, and then it is inserted on the greater trochanter of the femur, and then the external, it helps in the external rotation of the hip. And the blood supply and is the superior and inferior gluteal arteries and the lateral sacral arteries. Now let's move to the option. They have asked that which statement is true. The nerve supply is by S2, S4. No, we have discussed that it is L5 to S2, and the origin is the ischial tuberosity. No, it originates from the sacrum and inserted onto the greater trochanter. Yes, it is inserted on the greater trochanter, and the main action is the internal. No, it helps in the external rotation of the hips, and the arterial supply is by the median sacral artery. No, the supply is by the inferior gluteal artery and the lateral sacral arteries. Now the next question, which of the following is contained within the deep perineal pouch? The deep perineal pouch, we have discussed that they are the superior perineal pouch and the deep perineal pouch. The deep perineal pouch, it is the proximal portion of the proximal portion of the urethra in the females or the membranous urethra in the males, it is present in the deep perineal pouch. So moving towards the answers, the answer A, the option A is the answer, that the proximal portion of the urethra is present in the deep perineal pouch. The fat layer is in the superficial fascia. The ischiocavernous muscles are again the superficial. The bulbospongius is again the superficial, and superficial transverse perineal muscles are again the superficial perineal pouch of the. Now the next question regarding the lymph drainage of the lower vagina. Regarding the lymph drainage of the lower vagina, where does the majority of the lymph drains to? The lower vagina, the lymphs, they drains to the inguinal nodes. Answer is C, that the lower vagina drains into the inguinal nodes, whereas the upper vagina, they drains into the internal and external iliacs. Question number 40, what kind of epithelium they lines the endocervix? The endocervix, they are the lining of the endocervix, they are the columnar cells. It's important to note that the endo and exocervix, they have the two epithelial layers, where the columnar and the squamous epithelia they meet in the is the transformation zone or the squamo-columnar junction. And this is very important. Like this is uh, the these are the squamous cells. These are the squamous cells, and these are the columnar cells. And where these squamous and columnar cells joins, this is the transformation zone. Transformation zone. This is very important regarding the cervical cancers. We are going to discuss there again. And now let's move towards the question number 41 regarding the levator ani. Which of the statement is true? The um, arterial supply is from the inferior gluteal artery. Yes, the levator ani is supplied by the inferior rectal artery, and the arterial supply is from the superior. No, it is from the inferior rectal artery. Sorry, it is not from the inferior rectal artery. It is from the inferior gluteal artery. The answer is inferior gluteal artery. The arterial supply to the levator ani muscles is the inferior gluteal arteries. Here the option of the inferior rectal artery is wrong. The option of the superior rectal artery is again wrong. The option of the internal iliac artery is again wrong. The option of the inferior gluteal artery is true, and the superior gluteal artery is again wrong. Okay, in the explanation, the levator ani muscles, they receives its arterial supply from the inferior gluteal artery. Now the next question, what is the approximate length of the female urethra in centimeter? It is again the 4 centimeter, and the male is 20, average is 20 to 22 centimeter. And now the next question, the inguinal canal is reinforced posteriorly by which structure? Posteriorly, it has got the conjoint tendon. Yes, that is true. The conjoint tendon, also known as the inguinal falx, it reinforces the posterior wall of the inguinal canal. The inguinal and lacunar ligaments are the part of the floor, and the aponeurosis of the external oblique is the major components of the anterior wall, with the fibers of the internal oblique reinforcing the lateral part. Next question, the superficial perineal pouch, it is bounded superiorly. It is bounded superiorly by the it is the perineal membrane. The perineal membrane, it is the superior border of the superficial perineal pouch, and the inferior border is the fascia of the perineum, also known as the gallud jet fascia, also known as the deep perineal fascia. Question number 45, which of the following is the innermost layer of the testes? The innermost layer of the testes is the tunica vasculosa. Here there is the testis. The outer is the skin. Outermost is the skin. Then there comes the dartorius muscles. Then there is the facial area. Then the tunica vaginalis. Then tunica albuginea, and then tunica vascularis. It is the innermost layer of the testes. If we start from the outer, there is skin. Then there are the dartos muscles. Then there is a facial layer, then tunica vaginalis, then tunica albuginea, and the innermost is the tunica vascularis. Now, question number 46. The distal transverse colon is supplied by which artery? The distal transverse colon. It is supplied by the inferior mesenteric artery. Question number 47. Which area of the hypothalamus it releases all of the following? These are the thyrotrophin releasing hormone, corticotrophin releasing hormone, oxytocin, vasopressin, and somatostatin. They are released. These all are released by the paraventricular nucleus. It is the paraventricular nucleus. Question number 48. You are asked to assess a patient's perineal tear following the labor by the vaginal delivery. You notice a laceration that extends to the external anal sphincter and has partially torn the internal anal sphincter. How would you classify the tears? We have discussed previously that that if the external anal sphincter it is intact, if it is intact, then the tear would be either 1 or 2. If the muscles are involved, then it is a 2. If the muscles are not involved, then it is the first degree tear. But here, the external anal sphincter, it is involved. Here, the internal anal sphincter, it is involved. Not only external anal sphincter, but also the internal anal sphincter um, is partially involved. So this is the tear which is classified as third degree tear along the grading of the C. It is the 3C, and the perineal tear which involves the internal anal sphincter, they are the type 3C. So the correct answer is 3C. Now the question number 50. Leydig cells, they contains receptors to which hormones? The Leydig cells. L for Leydig and L for LH hormones. L for Leydig and L is for LH hormones. The Sertoli, the other are the Sertoli cells. They secrete the testosterones. L for Leydig and sorry, the Sertoli cells. The Sertoli cells, they secretes inhibin. They secretes the inhibin. The Sertoli cells, they secretes inhibin, and Leydig cells, they secretes the testosterone, and they have the LH receptors. Though the Sertoli cells, they have FSH receptors. Okay, I think I have confused this for you. I'll explain this again for you. Testes, they have two types of the cells. They are the Leydig cells and they are the Sertoli cells. Leydig cells and the Sertoli cells. The Leydig cells, they secrete the testosterone, and Sertoli, they secrete the inhibin. And then L for Leydig, they have LH receptors, and the other has the FSH receptors. Now I think I have explained this to you, and this is going to help you to memorize as well. So far we have discussed the top 50 MCQs and SBAs. I hope you like the video. If you like the video, then do share it with your friends and subscribe to my channel. And we are in the next video, we are going to discuss more MCQs which are going to help you to clear your concept. And take care till next time. Bye bye.